Okay, so these are the next few slides are just rhythms. So we're not looking for heart attacks, we're not looking for ischemia, we're just looking at one rhythm strip at a time, okay, and seeing what it is. And I would say this is optional. If you feel comfortable with rhythm strips, then you don't need to go through all these. But let's the more you see, the better for sure. Okay, so the first one. Um, Now the answers are on the left, but let's see why that's the answer. So we're looking at a rhythm. We're trying to determine what the rhythm is. Ask yourself, is there a P wave before every QRS? Are they associated with each other? Okay, so let's look at this one. P, QRS. Okay, there's a T wave too, but that's okay. And then P, QRS. P, QRS, P, QRS. Okay, we've got it. This is sinus rhythm. There's no doubt. Okay, now ask yourself, how fast is it? So this one, 300, 150, 100, 75. Um, it's 60 on the dot, of course, but let's just say it's just above 60, so 61. We'll call it normal sinus rhythm. Okay, the one below it. Let's ask yourself the same question over and over and over again. Is there a P before the QRS? And there is before every QRS. Okay, well, it's sinus rhythm. It's coming from the sinus node and creating that P wave followed by QRS, right? But this one's fast. So let's see how fast. We'll go to one that lands on a bold pink line. And if we were to land on the next bold line, it'd be 300. Next one would be 150. So it's a bit slower than 150. So this is sinus tachycardia. Okay, so using the normal electrical pathway, it's just that it's fast. Why is it fast? Well, hypotension, fear, fever, pain. Okay, so those are things that can cause sinus tachycardia. Sinus bradycardia. So let's see why. This one's super slow, by the way. Let's go to the second one that has a QRS because I can't see the P wave on the first one. So is there a P before the QRS? Yes. And then go to the next one. Is there a P before the QRS? Yes. So this is sinus bradycardia at an unbelievably slow rate. I'm not going to calculate it, but it's definitely less than 60. So it's sinus bradycardia. Okay, so notice we're just doing the rhythm. Okay, let's look at the next one. Is there a P wave before QRSs? Yes. The first one. Second one, yes. The next one, yes, there is a P wave before the QRS, and so on and so on. So why are we calling this premature atrial contraction? So the third beat, or the third QRS, came a bit early, okay? It arrived a bit early, and the P wave doesn't look like the other P waves. This one's pretty close, but this is basically, so this rhythm, if someone asked what the rhythm was, well, the rhythm is normal sinus rhythm with PACs, okay, premature atrial complexes, but the rhythm is still normal sinus rhythm underneath, right? So the underlying rhythm is normal sinus rhythm, and every once in a while, the atrium is sending off an atrial complex, a premature atrial complex. And that's why it's arriving a bit early. And if you were to feel this person's pulse, it would feel a bit irregular because those premature atrial complexes are coming a bit early. Okay? Totally harmless, nothing to do. Maybe tell them to stay up. Just diminish coffee and any stimulants. Okay, next one. So we look at this rhythm, and when you eyeball it, you'll see that the distances between the QRSs are different. So it's irregular in time, right? If you felt this person's pulse, it would be irregular. It wouldn't be timed perfectly like sinus rhythm. Okay. Now, the next question is, are there P waves before every QRS? Okay. And when I look at this, I actually don't agree with this one. So I'm seeing actually little tiny upside down P waves between the QRSs. And you'll see those little squiggles going down over and over and over again. This is actually atrial flutter. Okay. Oh, it's mentioned atrial flutter. Sorry. I thought it was saying atrial fibrillation. This is atrial flutter. So there's those P waves that's that electrical circuit going around the atrium. Okay, and some of them are being allowed through to the ventricle from the AV node and being conducted and becoming a QRS. Okay, so you can see those little P-like waves. Most of them don't have a QRS attached to them, but every once in a while the AV node lets one through and you get a QRS. So they don't have that typical sawtooth appearance, but this is atrial flutter. Sorry about that. The next one, okay, it's irregular in time. So the pulse is all over the place, right? If we were to follow this pulse in terms of the QRSs, let's just do it. Beep, beep, and then a break. Beep, break, beep, long break, beep, beep. So irregular, right? So atrial fibrillation is always irregular. Okay, are there any P waves before the QRSs? No. This is atrial fibrillation, right? They need to be on an anticoagulant. And if they were going fast, which they aren't in this case, they would need to be slowed down with a beta blocker or a calcium channel blocker. And if it was within 48 hours, we could offer them cardioversion to put them back into normal sinus rhythm. If it's beyond 48 hours, we anticoagulate them for 6 weeks, and then we can offer cardioversion. Okay. First degree block, well, let's just do this one and see what it is. So there's a P wave all by itself, and then there's a QRS. Okay, so maybe they're attached, maybe they're not. It's hard to tell. Let's keep on going. There's a P wave, and then a QRS. Okay, same PR interval between the first conduction and the second conduction. Let's go to the third beat. P wave, QRS, and it just continues that way. So there's no dropped QRSs. The AV node is letting every P wave be conducted. It's just taking longer. That's a first degree AV block. Okay, next one. It's labeled second degree type 1 heart block. So let's have a look. There's a P wave and then a QRS. Okay. And then let's go to the next one. A P wave and then a longer interval. So the PR interval is lengthening, and then there's a QRS. And let's go to the next one. There's a P wave and no QRS. It's missing. It dropped it. So that's Winky back. Okay, or second degree heart block type 1. Okay, Mobitz type 1 or Winky back. Let's go to the next one. Second degree. Oh, by the way, second degree heart block type 1. No need for a pacemaker. May need to see if they're on any medications that are slowing down their heart and remove them, but generally it's still safe. Second degree type 2, so Mobitz type 2. So let's have a look. There's a P wave and then a QRS. And there's, I'm going to say that's a T wave after the QRS, and then there's a P wave, a QRS, and a T wave again. And then we get a P wave and oh, there's nothing. It just suddenly dropped it. Okay, and you can continue on this rhythm strip and see other P waves that were suddenly dropped with no QRS, meaning it didn't get conducted into the ventricles. So unpredictable dropping where the AV node just says, no, I'm not conducting you, that is second degree type 2. That's going to need a pacemaker. Okay, a permanent pacemaker. Third degree heart block. So let's go along here, and the first electrical activity I see is a QRS, and then I see a T wave after the QRS, and then I'm going along, and oh, I come across a P wave, nothing, and then another P wave, and then there's a QRS, and I can go along and I can see a whole bunch of P waves that just have nothing. There's no rhyme or reason between the P waves and the QRS. There's no communication occurring. So the P waves are just marching through because the SA node is still working, but nothing's getting through to the ventricles. So then the ventricles use their automated pacemaker and they beat really slowly at around 20 to 30 beats per minute. Okay, so that's third degree heart block. That definitely needs a pacemaker. These patients come in dizzy, collapsing, they're falling over because their blood pressure is dropping. Okay. Okay, a couple more rhythms and we're done. So let's look at the top one. So ask yourself, is there a P wave before every QRS? So I see P, QRS, P, QRS, P, QRS, and so on. And then there's this big, wide depolarization. Let's ignore that. Come back to it. And then there's a PQRS, PQRS, and then another wide depolarization, and then a PQRS, and so on. So the underlying rhythm is normal sinus rhythm. What are these two beats that are electrical depolarizations? Those are PVCs, right? That's where the ventricle is a bit irritable and it suddenly just depolarizes itself and causes a PVC. So this person's pulse would be regular, 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 and then there'd be an extra beat from the PVC, and then regular, regular, and then an extra beat from the PVC. Okay. Typically, we don't do anything for these unless they're very frequent, and then we can use an antiarrhythmic, such as amiodarone, if they're super frequent and they're causing a lot of symptoms for the patient. Okay. If they're infrequent, no treatment needed. Okay, the next one, rhythm number 2. So P wave, QRS, P wave, QRS, P wave, QRS. What is this? Normal sinus rhythm. Is it going too fast? No, it's not sinus tachycardia. Is it going too slow? Sinus bradycardia? No, it's normal sinus rhythm. What's the rate? 300, 150, 100, 75 on the dot. And you can measure that out to see if that's the case. Okay, last one. PQRS, PQRS, PQRS. Okay, so I'm done. I know this is sinus rhythm. I just have to ask myself, is it fast, slow, or normal? Okay, so this one's a bit hard to see with the lines. But if you were to find one on a bold line, you would see that this is going at 300, 150, about 130 beats per minute. So this is sinus tachycardia. Okay, good. I hope those help.